I'm Todd Neale with MedPage Today. I'm at the American Society of Hypertension meeting in New York. A study presented here compared two fixed-dose combinations of an angiotensin receptor blocker and a diuretic in patients with stage 2 systolic hypertension. One is an investigational combination of azilsartan medoxamil and chlorthalidone, and the other is an approved combination of olmesartan and hydrochlorothiazide. Dr. William Cushman of the University of Tennessee discussed the study at a press briefing here.
The study design for this study was the typical washout period with a placebo run-in and then randomized double-blind to azilsartan medoxamil, chlorthalidone 20, 12.5 or 40, 12.5, so a lower and higher dose of the azilsartan, and then compared with olmesartan hydrochlorothiazide 20, 12.5. And the goal of this study was really to force titrate to maximum doses, if you will, or to top doses. The olmesartan hydrochlorothiazide comparison was force titrated to the maximum approved dose of that combination, olmesartan 40 and hydrochlorothiazide 25. And so the force titration, the ARB dose was doubled to the maximum, to the top dose at 4 weeks, and then the chlorthalidone or hydrochlorothiazide were doubled to 25 milligrams at the 8-week.
The primary endpoint was the difference in blood pressure measured in the clinic at 12 weeks.
So the olmesartan hydrochlorothiazide was a reduction, all starting out at about 165 millimeters of mercury, so a reduction of 37.1, which is quite good, quite impressive, and then about a 5 to 7 millimeter mercury greater reduction for both olmesartan chlorthalidone combinations with not much difference, a little bit different for the 80-25, but not much difference in blood pressure between the two azilsartan arms. So this is the first large forced titration study of an ARB chlorthalidone fixed dose combination. There are previous studies where you titrate if needed for blood pressure control, but this really gives kind of the maximum comparison in terms of the effectiveness or efficacy between these products. The study demonstrates superior efficacy of the azilsartan medoxamil chlorthalidone fixed dose combinations, both of them compared with the olmesartan hydrochlorothiazide, and tolerability was relatively similar for the lower dose of the azilsartan chlorthalidone and the maximum dose of the olmesartan hydrochlorothiazide. There was a moderately higher adverse event discontinuation rate, as I've shown you, for the higher dose of azilsartan chlorthalidone.
Cushman said he does not know which dose of the azilsartan chlorthalidone combination the maker of the drug, Takeda, intends to bring to the market. For MedPage Today, I'm Todd Neale.